What are you doing now?
We're collecting fluids from the rash.
Why?
They know what they're doing, Jeffrey.
Oh, great endorsement coming from the woman who thought it was a nasty cold. If I'd had him last week and he'd have
This isn't helping.
We're checking to see if your son has a tick bite.
Gabe, have you been camping recently? Playing sports outside, anything like that?
I'm not that good at sports.
No hanging out anywhere new? Strange
We've
places?
been through this. We don't let him run wild through the neighborhood, right?
Okay, this might be a bit delicate. We need to know if you're sexually active.
I beg your pardon? Who do you
Mr.
think
Rylick,
No.
we need to...
Nothing like that.
We've got to get another CT scan, check his lungs again.
Third floor, right?
Yeah, radiology is
Sorry, medical personnel only.
Enlarged hilar lymph nodes.
Parabronchial thickening.
Pleural effusions.
Less obvious, more scary.
Well, the mediastinum doesn't look right.
Slightly widened. Oh, God. It can be transmitted through infected animal hair. But the gram stain would have
No,
shown...
the cefuroxime would have killed some of it, clouded the result.
We've got to get this kid on Levaquin.
What does he have? Anthrax. This house belonged to old man Hussein.
Maybe he is cursed.
Anthrax. So what, you think there were terrorists in that attic?
It's a naturally occurring bacteria. We believe it was in the insulation.
How sick is he?
Anthrax is very dangerous, but we've caught it early. He's on Levaquin. It's the best antibiotic we have.
Lisa, you buy this?
Jeff, you've helped our hospital a lot. I wouldn't have assigned Dr. House to your case if I didn't have every confidence in
Then
him.
who's this guy?
Jeffrey?
There's all these weird diseases that can cause a rash. What about leishmaniasis or filariasis?
Where'd you hear about those?
Internet. I did some research.
Well, those are very rare conditions.
Oh, and anthrax grows along the interstate?
Leishmaniasis doesn't cause pneumonia, and filariasis...
Just look into everything. This is my son, all right? And I'm gonna stay on top of you until I know he's safe.
Wouldn't expect anything else. Everyone's a doctor.
Breathe, baby. It's okay. Breathe, I need you.
It's breathing. It's on the inhale.
What does that mean?
Means his airway's closing up.
Is the anthrax doing it?
All right, hold still, Gabe. This is going to be a little uncomfortable.
We've got you. It's okay.
Nodules in his throat.
Airway's occluded.
We've got to intubate. Out of back.
Pushing 3 cc's.
Airway's too tight. What's wrong? What's wrong? No, you're killing him!
Jeffrey, listen to the choke!
Airway's too tight. Give me a smaller tube.
We're traking.
Smaller tube.
His lips are cyanotic.
Oh my God, he's not breathing.
Foreman, we're traking.
No, I can do it. I'll get it. Foreman, you're not getting through.
He's not getting air. Oh, we have to trach him right now.
No, I can do it.
Betadine. I'm doing this.
Got it.
You mentioned 2 obscure diseases to Dr. Chase. How'd you know about them?
I read about him on the internet.
So what did you search for? Diseases from Asia that don't match my son's symptoms? You heard about them in Asia.
I've never been there.
Well, you probably just forgot. Let me refresh your memory. Some remote, dusty village, close quarters, at least a year. Starting to come back.
Calling Dr. Cuddy.
Excuse me, what does this have to do with our son?
Your dad's pissed off. He should be. Comes here expecting us to do an extra good job because he gives a whole lot of money to this hospital.
Don't talk to my son like that!
Just telling him my job, my obligations.
Stop! What's going on?
There's only one thing you guys have got to do.
Tell the truth, or your son will die. How long were you in Asia?
Jeff, it's a simple question.
2 years in India.
Why would you lie about something like
It was
that?
87 and 88. This guru, I thought he had some answers. I went to his ashram and ended up with no money and no answers. I was embarrassed. I didn't want anyone to know.
No. No, you were a test pilot.
I'm so sorry, Gabe.
What does this have to do with my son?
Clue number one. If I were Jesus, curing this kid would be as easy as turning water into wine.
Demonic possession?
Close, but no wafer. Clue number two, rheumatology Roan was almost right. It causes autoimmune symptoms.
Leprosy? Yeah, that's real big in the Jersey suburbs.
It's leprosy. Run a fight stain, it'll be positive. Daddy hung out on the wrong kind of Indian ashram.
But it's obviously dormant in the dad. How could the kid catch it?
It's not dormant in the dad, it's just slow. Damaged his ulnar nerve, was misdiagnosed as carpal tunnel. Never trust doctors. Run a fight stain.
No wonder he got anthrax. The leprosy weakened his immune system.
Vicious circle. The leprosy made him vulnerable to the anthrax, and the anthrax treatment put the leprosy in overdrive.
But the antibiotics we gave him, they cure leprosy.
Yeah, that's where the trouble starts. The antibiotics hit the nerve strands, they kill the leprosy bacteria, and the corpses get tossed into the system. And as fascinating as our bodies are, they're also stupid. Produce antibodies that beat dead bacteria. And these aren't the polite antibodies. They're the ones that won't sit still, kick during nap times. They attack his neural and fat cells, causing inflammation and all the rest of his symptoms.
So the cure's killing him.
I want you to call down to Carville, Louisiana, home of the last leper colony in the lower 48. Get them to send up some thalidomide.
Thalidomide?
12-year-olds don't have sex, right? So we can't be pregnant. Make the call. While you were all wearing your Frankie Says Relax t-shirts, I was treating a 73-year-old woman who went through this progression of symptoms, the last of which was, in case any of you missed that class in mid-school, that one's untreatable. Kids got the first two. It took Esther an hour and 20 minutes to go from 2 to 3, and less than a day to make it all the way to the rear exit.
This is all because a child has some blood in his diarrhea. He's got a tummy ache. If there was any reason to think it was anything worse, Cuddy would be all over it.
Great. Do a colonoscopy.
And a 6-year-old kid who probably has nothing worse than some food poisoning.
And if you happen to find any purple papules, do me a favor and grab a slice. I want to check for Erdheim Chester.
A disease that there have been, what, maybe 200 reported cases of, ever?
If Esther's family had let me do an autopsy, there'd be 201.
It's not the first time I've seen this file. About a month before Cameron was hired, some trucker came in here with these symptoms. House decided he was dying. 2 days and a spinal tap, bone marrow extraction, and 3 colonoscopies later, we send the guy home with a bunch of painkillers and a diagnosis of a bad cheese sandwich. One of the guys who worked here before me said House tried to cure Esther at least 3 other times. You know how people see the Virgin Mary in Danishes and stuff? Someone died 12 years ago, and House doesn't know why. House sees that case now, and paint peeling, and clouds, and now this poor kid.
It's not Erdheim, Chester.
It's exactly what we said before. A garden variety viral gastroenteritis. Can we go back to the party?
Do a kidney biopsy. Esther's shut down in exactly...
This kid is not Esther. You screwed up. She died. I'm sorry, but that does not mean this kid is dying as well.
Jeez, you can test you when you don't get any fuzz. Come on.
What'd the test say?
Colonoscopy was clean, and the biopsy was negative for Erdheim, Chester.
So Ian's gonna be all right. It was just some sort of virus.
What's that?
Urine.
Oh, but it's brown.
Ian's kidneys are shutting down.
Still think it's not the same case? What explains everything?
E. coli HO157 causes bloody diarrhea and leads to hemolytic uremic syndrome. Toxins from the bacteria cause these kidneys to shut down. We should start him on plasmapheresis.
Clear, concise, and completely plausible. And exactly what I did last time. Didn't work. What else?
Goodpasture syndrome. Circulating antibodies cause kidney failure and bleeding.
But not the purple papules.
If you throw in Esther's next symptom, brain, makes me think heavy metal
His
toxicity.
hematocrit would have to be low. It's at 44, and Esther's never dropped below.
42.
You have the file memorized?
It's my lucky number.
What? What's happening? Ian, come on. Honey, just relax. Ian, breathe. Come on, honey. Please. Please, honey.
How many tests can we do with that? Look, we cure the kid, we solve everybody's problems. How many?
Maybe 2 good pieces.
How many okay pieces?
3'd be pushing it.
3 tests, 7 choices. Okay, what's first?
Sarcoidosis seems most likely.
Yeah, so likely Cubby's gonna think of that all on her own. She's got the kid's whole body to play with. Let her do that test. What's next?
It's moving too fast to be spreading. It has to be grown from something that's already there.
Genetic disorder, tuberous sclerosis.
Or it's his immune system, histiocytosis.
Well, there are more documented cases of histio amongst older people than tuberous sclerosis. Let's start with that. You want me out of here?
You come up with anything?
No.
Hey.
We can talk about it tomorrow.
I won the poker tournament. I totally played this guy Berman from Business Affairs. I got great cards, but I don't bet. Just call, no raises. Berman pairs his king on the flop. I keep calling. The river turns. I check. He can't stand it. He goes all in. He's sure he's won. I call. I flip him.
Pocket aces.
I nailed his ass.
The aces were hiding all along. Test him for Erdheim-Chester disease.
Erdheim-Chester? That's not even on the list.
Because we already did it. He tested negative.
So did Esther.
Disease lied.
Yeah, the tumor's got it in for you. Diseases don't lie.
Fine, it didn't lie. It's slow platus. We biopsied the colon. It hadn't reached the GI tract yet. It's there now. It's in his liver, his lungs.
You want it to be there. Because then you didn't screw up 12 years ago.
We can't waste our one test on the one disease we know it's not.
Run the test.
Sure about this?
Wait, let me think about that. Don't pressure me. Just run the damn test.
Cells look like macrophages.
That's a good start. Take your time and say it loud.
CD68 positive. Hannah? Hannah! You fell asleep.
No, I didn't.
Your brain doesn't remember. It was just a few seconds.
Is this really necessary?
The sooner we find out what's wrong, the sooner she can get a real night's rest.
Hannah? Hannah? Hannah?
Ow! What did you do that for?
You fell asleep again.
No, I didn't.
We're sorry.
We have to do this.
We don't have to be cruel.
You know what happens when you're nice. Nothing.
That's how you define nice, not stealing.
Doctors?
Did you fall asleep again?
We've got rectal bleeding.
What, all of you? So the monster is peeking out from under the bed, which either means she has a clotting disorder or she has a tumor in her colon.
I'll do a colonoscopy.
Who's keeping her awake now?
I figured once we found another symptom, it really didn't matter.
Yeah, he's got all the ideas.
Who is with her?
Her partner's donating blood, so she's with a nurse.
Probably singing her lullabies. I want her awake.
You have to sedate a patient to do a colonoscopy.
Why? Just because of the pain? If you find a tumor in her colon, you can knock her out. If you don't, she stays awake.
Packed her nose to control the bleed and started transfusing 2 units of whole blood.
The pathology from the rectal bleed showed traces of nasal epithelium.
So the butt bleed's just a nosebleed.
That much blood is not a just a anything.
When 2 people fight this much, you know what it means.
It's got to be a massive sinus hemorrhage that was draining down her throat and out the back.
The question isn't what, it's why.
Oh, get a room.
Rat poison mixed with some sort of neurogenic toxin could cause bleeding and sleep disturbances.
Do you have a specific type of neurogenic toxin in mind, or should we just start running 1,000 different tox screens?
Just pretend I'm not here. I'll be reading.
Could also be some type of coagulopathy.
Or it could be us. Do you have any idea what it feels like to have a 6-foot-long hose shoved into your large intestine?
No, but I now have a much greater respect for whichever basketball player you dated in college.
We've basically been torturing this girl for the last 8 hours.
You've been poking her foot, not punching her face.
Extreme stress can cause high blood pressure, which can cause bleeding.
Wouldn't keep her awake for 10 days.
What if the poison ivy wasn't poison ivy? She got the rash that was diagnosed as poison ivy around the same time the insomnia started. Rash plus nosebleed plus sleep disturbance equals Wegener's granulomatosis. Start corticosteroid treatment.
The poison ivy treatment with steroids.
Much lower dosage. Get her back on the juice, triple the dose. Get a C-ANCA and an upper airway biopsy to confirm the Wegener's.
Chase?
Hannah, you still with us?
What's wrong with her eyes?
Looks like REM.
What's that?
Rapid eye movements is what your eyes do when you're sleeping.
But she's awake.
Hannah. Hannah, can you hear me?
Yeah, of course.
Was she sitting up or lying down?
Sitting up.
And it wasn't REM.
Chase says her eyes were moving the exact way.
She started her on the steroids?
Not yet. We were still doing the...
She wasn't sleeping.
How do you know?
Because we haven't done anything yet. She may be able to sleep with her eyes open, but unless you also discovered she's got 2 extra teats and hooves for feet, there's no way she'd be able to maintain enough muscle tensity during REM sleep to sit upright. It's a movement disorder, which rules out Wagner's. Where's the foreman?
Keeping her awake.
Good.
Rabies could cause muscle spasms, malaise, anxiety, and wakefulness.
Pretty unlikely she'd forget being bitten by a crazed animal.
She could have been exposed to an open wound.
Did she have a dog?
For less than a week, she had an allergic reaction, so they had to give it away.
Allergies.
Animal allergy seems unlikely, but it's possible that...
When?
When what?
When did she get rid of the dog?
About a month ago. Her girlfriend gave it to her for her birthday.
Well, then it's not allergies. She's just leaving her girlfriend.
You spoke to the dog?
If her birthday was a month ago, she would have still been on steroids for the poison ivy. And those meds would have suppressed any reaction she might have had to the dog, which means she lied about being allergic. The dog's a commitment. You pretend to be allergic because you don't want to tell your girlfriend that you're not planning on being around that long. So I think we can move on to options other than allergies.
We should still do a scratch test. If she's allergic to one thing...
She is not allergic.
Okay. Well, we could either base our diagnosis on your admittedly keen understanding of lesbian relationships, or we could do a scratch test.
Do a scratch test.
Fever's 106. She's in full rejection mode.
Is that supposed to surprise me?
Her white count is normal.
Normal is not normal. She's been on steroids. The transplant team gave her a cocktail of immunosuppressants. She hasn't slept in over a week. Her white count should be in the tank.
Looks like the problem is some sort of infection. Probably caused a hypotension, shocked the liver.
We should start broad-spectrum antibiotics.
Yeah, you might want to add some chicken soup. It'd be just as useless, but it's got chicken. We need to know exactly what kind of infection we're dealing with. What infection causes sleep disturbance, bleeding, movement disorder, organ failure, and an abnormally normal white count.
What about tularemia?
Chest was clear. Tularemia doesn't cause movement disorders.
It would if she developed meningitis.
There was no ulcerations on the skin. With the bleeding, it looks more like leptospirosis.
Without conjunctivitis and elevated creatinine?
What about typhoid or some kind of relapsing fever?
Makes sense if we were in the Sudan.
You sure she hasn't been out of the country?
She hasn't even been out of the state in at least a year, neither has Max.
Maybe she lied. You talk to her friends, neighbors?
You don't know? Come on, if you don't stay up to date on my notes, where's your next article gonna come from?
Talk to the dog?
We're not as up on foreign languages as you are.
Has the dog been traveling?
It came from a breeder.
Where?
I don't know. A place called Blue Barrel Kennels. They only had the thing for like 2 days.
Blue Barrel is a kind of cactus. You see many cacti in Jersey? Want to see a magic trick? Oh no! Where'd it go? Where'd it go? Is it here? No. What about here? There it is. Oh, that doesn't look anything like a nose.
That wasn't there this morning.
Call a CDC.
Tell them what?
That we have a patient with the plague.
The Black Plague?
Looks that way.
Plague's carried by rodents, not dogs.
Where there's dogs, there's fleas. If they hail from the southwest, and those fleas can't tell the difference between prairie dogs and puppy dogs. A small percentage of plague cases present with sleep disturbance. Imagine an idyllic river of bacteria. It's not idyllic for her, but it serves my purposes. The steroids and the immunosuppressants acted like a big honking dam across the river. Physics 101, put a dam up in front of a raging river, the river rises. By stopping the immunosuppressants, we blew up the dam, and a 100-foot wall of bacteria flooded her lymph nodes.
We better find out where that dog is now.
After you restart the immunosuppressants, and fill her up to the eyeballs with streptomycin, sulfate, gentamicin, and tetracycline. Use a garden hose if we got one. Get yourself some prophylactic treatments as well.
I've got the plague.
Don't worry, it's treatable. Being a bitch, though. Nothing we can do about that.
Feeling any better?
How are you doing?
I'm not the patient.
You just said rate elevated.
No. So far, it looks like I lucked out.
Cameron, looks like you left a tourniquet on the bed.
You can see again?
Treatment's working.
Question is, which treatment?
We'll start weaning him off one at a time. Which one do we start with?
I don't care if you do it alphabetically. Just stay on top of his vision. First sign of regression means we've taken him off the wrong one.
Latest blood work. Foreman's amylase and lipase levels are 3 times normal.
Pancreas is failing.
A toxic side effect of his meds. Field of vision is regressing, and he's reached an 8 on the pain scale.
The disease pattern is following the exact course as Joe's.
Only it's moving much faster in Foreman.
Good. It's an anomaly. Anomalies tell us things. Why would this go faster in Foreman? What's different?
Could be a different strain of the same disease.
Right. We were wasting all this time looking for an unknown disease. We should have been looking for a different strain of an unknown disease.
Joe's a cop. He's into physical fitness. He could have had a more powerful immune system, stronger metabolism.
Foreman's black.
What? How long have you been sitting on this information?
Lupus, gout, glaucoma, osteoarthritis, hypertension, diabetes, stop me anytime. They all affect black people more than whites.
Check everything. Bacterials, fungals, toxins, parasites. Look for anything with a documented racial disparity. Wait.
The rat showing symptoms?
No. He's completely healthy. Maybe that's the difference between Foreman and the cop.
You're dying too fast.
Couldn't agree more.
Hey, Cuddy. Having a nice visit?
What's that?
Legionella pneumophila.
And why are you carrying a vial of it around with you?
Foreman was perfectly healthy before he got this infection. Our cop wasn't. He had Legionnaire's disease, and our cop didn't turn into brain food until we cured the Legionella. Legionella slowed down the disease.
Why would that happen?
No idea. Just know that it did.
So you want to infect Foreman?
You're gonna tattle to the CDC?
The meds can't help me, but a disease can? Forget it. Just take the pain away and put me under.
Put you under, I can't monitor your pain. If I can't monitor your pain, I won't know if the Legionella is working.
I'm not consenting to you giving me...
What was that?
Wish there could have been a puff of smoke or something. Would have been much more dramatic. Keep your slippers on. Wouldn't want you to cut your foot. What type of illnesses affect humans but not rats?
Why are you asking me that?
Because I'm sure that you spent the first 12 years of your life dreaming of being a vet. The rat is not getting sick. Cameron is not getting sick.
Sorry.
It's okay. It's not your fault. Presumably you're still healthy because whatever it is not bloodborne. Steve has no excuse. He did everything that Foreman did.
Some bacterial infections don't affect rats.
Foreman tested negative for every bacterial infection that would affect his brain.
And what infections could he be positive for but test negative for? When we test for infections, we look for antibodies. And what if the patient is infected but has no antibodies? What if the body is not fighting the infection?
Why would...
I asked first. Let's start with the what. We'll deal with the why later.
If the body doesn't recognize the infection, our tests come back negative and the disease rampages through the body unstopped.
Exactly like the cop and exactly like Foreman. And what if the patient was then exposed to a second infection, like Legionella? The body would recognize that infection, increase the white count, send in the troops to start fighting, and the initial infection would get caught in the crossfire. So the question becomes, what type of bacterial infection affects humans but not rats, and the human body would be unlikely to recognize? The answer is Listeria. I'm starting you on Amp and Gent.
So you're basing this theory on the test being negative and your rat being healthy?
And the fact that Legionnaires is helping you.
But the medicine you want to give me will put an end to that.
Yeah.
And if it's not Listeria, all the Gent will do is cure the Legionnaire's disease and put whatever is killing me back into overdrive.
Stop asking me questions based on the premise that I'm wrong. Antibiotics are in the airlock.
I think the first biopsy didn't give us the answer because you didn't go deep enough. I want you to do a white matter brain biopsy.
Absolutely. Don't blame you. The world is such a complicated place if you've got higher reasoning skills. I'm often jealous of small animals and retarded children. Take the antibiotics.
There can be minimal damage if it's done right. If the surgeons drill where I tell them to drill.
One slip. You could spend the rest of your life not being able to keep your drool in your mouth.
I'd rather be disabled than dead.
Sure, I make it look oh so sexy. It's actually not as glamorous as you might think.
The biopsy will tell us for sure what's wrong.
The antibiotics could do the same thing.
Could, not will.
We tried, we see.
The antibiotics will bring back the pain!
Pain makes us make bad decisions. Fear of pain is almost as big a motivator. Look, we still have time. I will do that biopsy if I have to, but not a moment before.
Prep the drill. We've got to be ready to go if we get the signal.
I screwed up the first time through this place.
Foreman told you everywhere he went.
It's not where, it's when. He came here early afternoon. Me and Steve came through 2 hours too late. You were 6 hours early. It's the water. The irrigation system only pumped.
House, I tested the water. The water's clean.
House.
We tested the wrong water. He stole cable, he stole fertilizer, and he stole water. It's riddled with Naglaria.
I know.
You already did the biopsy.
I thought I had no choice.
Munchausen's pretend to be patients, not doctors. He's got mirror syndrome.
Giovannini's?
Do you know another mirror syndrome? Brain's got no idea who he is, where he is, what he is. So it fills the holes with whatever dirt's lying around. He reads a name tag. He's got a name. Sees a doctor, he's got a job. Sees symptoms, he's got a problem.
My explanation's simpler.
Well, if it's simple, then we discharge the nut bar. But if it's complicated, then the nut bar has got brain damage.
So we let him jerk them around for a few days till we're sure?
No, we let him jerk you around. There's a faster way. Mind if we play through?
Sure. What could possibly go wrong?
What's going on here, Martin?
Operation?
House? Who is this guy?
Excellent question. Who are you, Martin? Just likes to watch and do stuff.
Number 10 scalpel for initial incision. Glad you're here, House.
Of course you are. It's lecture time.
Yeah, it is. Stop worrying about the power play.
Was that it? I think you can go a lot deeper here. I mean, why am I so obsessed by all of this?
You're threatened by Foreman and feel the need to impress Cuddy. The only thing that's relevant is Foreman is a good doctor. He can help you. Lighten the load.
Good idea. I'll have him sort my mail.
Sure. Deflect.
Who is this guy?
I think we just found out.
It's all about Cuddy. Gotta be the alpha dog. Can almost smell the pheromones now, huh?
I like him.
Told you I didn't need you.
House!
House, what is going on?
Ow!
Blood's turned to sludge. If we don't heat you up, you're gonna die. Can't fake that!
Infections can hide deep beneath the skin. This will find them.
Who was that last doctor?
Dr. Amber Velakis.
Don't really need her name.
Wait, you saying that I want her?
Don't know what you want, don't care what you want.
I'm married.
So am I.
Even if I wasn't, she's a little too, aggressive for me.
Hey, aggressive is never a bad thing.
Yeah, true. I'm done.
You okay?
Yeah. We gotta run some more tests. You can clean yourself up.
Lesion on the liver.
We're gonna use your spinal fluid to tell us where you lived.
Cool.
Not really. It's a poor substitute for an actual history, and without...
Nah, it's cool.
Yes, it is. I need you to stay as still as possible. Ignore the pain.
Bring the pain.
I'm not a masochist.
Neither am I.
I know, but I was responding to you, responding to... Never mind. I just like experience. If it's new, it's interesting.
Yeah, not me. I don't just like new, I gotta have new. If it's not there, I make it there.
Really? I'm just easily bored.
There are 300 million people in this country. If I'm doing exactly what everyone else is doing, then who the hell am I? You know what I mean?
I'm just about finished.
I like hot tubs. They're nice. It was necessary. And that was all that mattered. It's exciting, isn't it?
You're happy?
Why wouldn't I be?
Oh, hey. Hey, you with me? I need help in here! Beat it, we gotta shock him. Get him out of the water.
How long's he been out?
Just a few seconds.
He's dry enough.
Not yet.
Dry faster.
10 more seconds.
He'll get brain damage. He
Cutter,
needs...
you aren't.
Wait.
He's dry enough. Clear.
You gotta...
It worked.
For one of them.
Hey, get in there, see how he's doing.
You were just in there.
Well, apparently, it's impossible to see anything else while I'm in there. I'm a blinding, white-hot light of power.
Got it. Pink, good size, nice specimen.
I'm scared.
It's okay. It's gonna be okay.
No. No, it's not.
I'm not interested in how he's doing. I'm interested in how she's doing. So get in there and tell me how he's doing.
You think he'll mimic her if I'm in there with her?
You're a powerful, dominating man, but who knows?
So I'm gonna get fired before her.
Yes, you're gonna get fired right now unless you get in there.
Nothing on the biopsy.
And how is he?
His fever's at 106.
I know. But how is he? Bitter? Sexually frustrated?
He's delightful. Loves the smell of freshly baked rhubarb pie and isn't afraid to love. Also, his rash is coming back.
He needs the meds and the tub just to keep him stable.
Fine, soak him again.
He'll be happy. Loves hot tubs.
No, you love hot tubs. Find the rest of the gang, tell them to meet me at the lecture hall.
Hate hot tubs.
What did you say?
I hate.
He likes. Who else was in there?
No one.
You didn't think to mention that?
The guy likes warm, swirling water. Didn't know that was diagnostic.
It's not. When it is the water hit him and he had a thought. Not about you, but about him. We need to splash him some more.
His way up, Sat's way down, muscles still spreading.
Interferon's not working.
Means this is smallpox.
Right. Because there are only 2 diseases in the whole wide world. What else could it be?
There's gotta be something.
No, it doesn't.
There are still no pustules on her feet. All the reasons you thought it wasn't smallpox still exist.
Forget her feet. Forget all those other reasons. Look at him now. The pox are dome-shaped. They're on 80% of his body, and they're not scabbing over.
This is textbook smallpox.
DDXing at this point, it isn't gonna make a difference.
Don't say that.
I'm sorry. House, you screwed up going in there.
You're killing me!
The suit will protect you if you haven't already been exposed.
My air supply's almost out.
We'll give you another canister.
Yeah, and when I change it, I will be exposed.
Just move him.
I wish I could.
Oh, that's great. So you know what you can do? You can move me. You don't know that I have smallpox yet.
We have to assume.
There's another isolation room on the 5th floor.
The problem is getting him from here to there.
So it's inconvenient. My having a fighting chance of life is inconvenient.
I'm sorry. You don't know that he'll catch it.
We don't know that it's definitely smallpox, not until we get the DNA results back from the CDC.
What do you think the dad just died of?
Would it kill us to talk it through?
Kill us? No. Save House? Also no.
Even if by some miracle it's not smallpox, there's nothing more for us to go on. There's no new data. There isn't going to be any. Where are you going?
To get more data.
Gerrit seems distant and preoccupied.
Who's Gerrit? Is he a slave?
Gerrit is the captain's kitty.
The captain's cat is preoccupied?
Skip the cat.
One goat, slaughtered for dinner, broke out the next barrel of wine.
Skip the food.
Can we go back to the cat? Did the cat get sick?
Smallpox is exclusive to humans.
Ship captains didn't have pets. Nothing and nobody went on those ships if it didn't have a purpose.
Hunting mice and rats.
For the crew. The hold was probably infested with mice. What if that's the difference?
What happened to Gerrit?
Ah.
Is that a sad ah or a cute ah?
Gerrit, he died. It's a sad ah.
Before he died, did he lose his fur?
How did you know?
Mice don't carry smallpox, but they do carry rickettsial-pox.
Which is treatable.
Just start them on doxycycline.
Based on a bald cat? You never heard of shedding?
What's the downside?
If we shove her full of antibiotics, plus the antivirals, it'll suppress her bone marrow.
That girl's about to die.
She probably is, and I don't want to risk pushing her over the edge.
At least look at the dad's body. Small patches of black dead tissue will prove I'm right. Eschars appear with rickettsial-pox, but not with smallpox.
If he had developed eschars, I would have noticed.
You haven't been within 20 feet of the guy in hours.
Have them check. Their job is to bleach the body, kill the virus, and get it out of there for Dr. House's sake.
Bleaching the body will destroy all evidence of rickettsial-pox.
There is no evidence. I'm not trying to hurt anyone here. I'm not lying to you. This is smallpox.
House, you have to examine the body.
I'm not going anywhere near it.
Look for eschars, hurry.
You think it's our pox?
The captain had a cat. He lost his fur and then died.
Step back, Dr. House.
It's kind of hard to do an autopsy in oven mitts.
Take him off.
Says the woman standing behind 2 panes of glass.
Do you believe me? Forget me. Do you believe you? You think it's rickettsial-pox, don't you? If it is, it's curable, and she's gonna die unless we can prove it.
You really are annoying.
Come on, House, come on.
Escar! Escars!
Start the girl on doxycycline. Right now.
You were good with her.
No, only after being bad.
Takes practice.
Maybe I should get a puppy.
Yeah, or pregnant.
You're gonna be okay.